All right, ready to jump into another deep dive?
Absolutely. Always ready to explore something new.
Well, today, let's look at this study using neuronavigation in miniature spinal surgery.
Okay, yeah, I've heard a little bit about this. It's interesting how they're using techniques from human medicine to make veterinary surgeries more accurate.
Yeah, it's pretty amazing, right?
Definitely. Especially when you think about how challenging it is to place screws in plates for spinal fixation in those tiny dogs.
Yeah, exactly. Like, imagine a Yorkie or a Chihuahua.
Right. Their vertebrae are so small and everything is just so close together.
You really have no margin for error. It's incredibly risky.
It is, absolutely.
So that's where this neuronavigation system comes in.
Kind of like a GPS for surgery.
Exactly. And in this study, they used it to guide plate and screw placement for lumbar spinal fixation.
And get this, they used miniature dog cadavers for the study.
Yeah, I thought that was interesting too. Plus, the surgeon was a novice.
Oh, wow, really?
Yeah, so that adds another layer of complexity to it,
Right.
trying to understand the learning curve with this technology.
It makes you wonder, did the system truly improve accuracy, even for someone without a ton of experience?
That's the burning question. And to make things even more challenging, the standard neuronavigation equipment was too bulky for these little dogs.
Oh, I see.
Yeah, it was just too big and heavy. So they had to get creative.
What did they do?
They ended up creating a custom 3D printed tracker.
Interesting. Did it work?
It did. And they managed to get it down to only 12 grams.
Wow, that's a big difference. The original one was 59 grams.
Huge difference, especially when you're working with such delicate anatomy.
Makes a huge difference. It's like choosing between a scalpel and a sledgehammer, you know?
Exactly. All right, so let's walk through how they actually use this system.
Okay, sounds good.
So first, they use 3D images from CT scans of the spines.
To get a good look at the anatomy.
Right. And with those images, the surgeon was able to plan the ideal trajectories for each screw.
Okay, so like mapping out the best path.
Exactly. And then, during the surgery, the neuronavigation system provided real-time guidance.
So as the surgeon is drilling and placing the screws,
Yep. The system is making sure they were following that pre-planned path.
I bet that level of precision is so important, especially to avoid hitting the spinal cord or any nerves.
Absolutely, it's critical.
Yeah.
And then after the surgery, they did postoperative CT scans.
To see how well they did, I'm assuming?
Exactly. They wanted to compare the actual screw position to the planned trajectory.
That makes sense. So what did they find? What were the results?
Well, before we jump into the results, I think it's important to understand lumbar spinal fixation a bit better.
Oh, you're right. We should lay that foundation first.
Yeah. So basically, we are talking about stabilizing a specific region of the spine using plates and screws.
Okay, so it's all about preventing further damage and promoting healing.
Exactly. You often see it in cases of instability or fractures.
That makes sense. But as we discussed, it's a very delicate procedure.
Yeah, especially in these miniature breeds. It's like working with a tiny puzzle.
It really highlights why this technology is so potentially groundbreaking. So now, are you ready to talk about those results?
Yes, let's get to the good stuff.
Well, first off, the study showed that the system was actually feasible.
So it worked.
It did, yeah. The custom tracker worked seamlessly with the whole system, and they also found that the accuracy was really impressive.
How accurate are we talking?
They found a median deviation of less than 2 millimeters for both the entry and exit points of the screws.
Wow, that's incredibly precise.
Right. Especially considering that we're talking about a novice surgeon here.
Yeah, that really highlights how impactful this could be.
Exactly. And when you look even closer at the specifics of the results, it gets even more compelling.
Oh, how so?
Well, they found that 85% of the screws were actually positioned safely.
Okay, that's pretty good.
Yeah. Only 1 out of 5 plates ended up being poorly placed.
Interesting.
Yeah. And the interesting thing is that the 3 poorly positioned screws were actually attributed to surgeon error.
Oh, so even with this advanced technology, there's still room for human error.
Exactly. Surgical skill and experience are still really important.
It's a good reminder that technology is just a tool.
Exactly.
But overall, it sounds like the study indicates a significant improvement.
Right. Compared to the traditional methods, this is a huge step forward in terms of accuracy and safety.
Yeah, for sure. But of course, it's still early.
Right. We need more research to really understand those long-term benefits.
And to refine the technology even more for wider clinical use.
Yeah, exactly.
So beyond this accuracy and safety data, what are some of the other potential benefits? I mean, what could neuronavigation bring to veterinary surgery?
Well, for one, the increased precision could lead to fewer complications.
Makes sense.
Yeah. If you can place those screws and plates with such accuracy, you minimize the risk of damaging surrounding tissues, nerves, blood vessels. things like that.
So less trauma for the patient.
Right, and a much smoother recovery and ultimately better outcomes.
It's not just about getting it right, it's about minimizing the impact of the surgery itself.
Exactly. And another really important benefit is the reduced reliance on intraoperative x-rays.
Oh, right. Explain that.
Well, surgeons currently use x-rays during the surgery to confirm the implant positions,
Sure.
but with neuronavigation, we could potentially reduce or eliminate the need for those x-rays.
Oh, so less radiation exposure for everyone.
Exactly, for both the patient and the surgical team.
That's a big plus, considering the long-term risks associated with radiation.
Yeah, for sure.
Plus, it could streamline the entire surgical process, maybe even cut down on anesthesia time.
Right.
Of course, no new technology is without its limitations.
That's true.
So what were some of the limitations noted in this study?
Well, one of the main limitations was the sample size.
Small sample size, how so?
They only used 5 miniature dog cadavers.
Oh.
So it's hard to say with certainty that these findings would apply to a larger population.
So we need more data to confirm these results.
Exactly. And they also used different vertebrae for the fixation, so that introduces some variability.
I see.
And there's always the potential for human error during the analysis phase.
Oh, of course.
They had to manually extract and compare coordinates from images, so there could be some bias there.
Okay.
And one last thing is that they used intact spines.
Intact.
Yeah, not spines that had experienced any trauma.
Oh, so it doesn't fully reflect a real-world scenario.
Right. Real-world spinal surgery often involves fractures, instability, things like that.
So it's a great starting point.
Definitely.
But we need more research with those more realistic surgical scenarios.
Absolutely. And while this particular study focused on lumbar spinal fixation, neuronavigation has the potential to go way beyond that.
Yeah, it seems like this technology could really benefit a whole range of procedures.
Oh, absolutely.
We were talking about how neuronavigation could be used for way more than just spinal fixation.
Right, yeah. We could see it used in all sorts of other delicate procedures, and not just in miniature breeds either.
Oh, interesting. So you're thinking cats, rabbits.
Exactly. And even larger animals, too. I mean, think about fracture repair, joint replacements, or even tumor removal.
Yeah, any procedure where you need that really precise placement.
Right. Whether it's for implants or just for navigating around sensitive structures.
This could really be a game changer for so many types of surgery.
It really could. And you know what's really interesting?
What's that?
It's not just limited to surgery either.
Really?
Yeah, we could see neuronavigation being used in diagnostics, too.
Oh, wow. I didn't even think about that.
Yeah, it could help us pinpoint lesions or abnormalities in the brain or spinal cord.
So you could get a much more accurate diagnosis.
Exactly. And then you can develop a much more targeted treatment plan.
It's like having a high-definition roadmap of the nervous system.
That's a great way to put it. And as this technology keeps advancing, I think we're going to see even more innovative applications.
It feels like we're just scratching the surface here.
Exactly. This is just the beginning.
So what does all of this mean for the average pet owner? What should they take away from all of this research?
Well, I think for pet owners, this research points to a future where veterinary care is even more sophisticated and precise.
It's reassuring to know that our pets will have access to this cutting-edge technology.
It really is. I mean, it means that their furry companions will have a better chance of recovery, less discomfort, and potentially even longer lives.
And it's great to see these advancements in human medicine, inspiring innovation in veterinary medicine, too.
Absolutely. It's a good reminder that we're all connected, and that by working together, we can do amazing things for both animals and humans.
So to wrap things up, we've really delved deep into this research on neuronavigation in miniature spinal surgery. We talked about the challenges, that ingenious custom tracker, the impressive accuracy, and the potential benefits. It's clear that neuronavigation has huge potential in the future of veterinary surgery.
It really does. It's an exciting time to be in veterinary medicine. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.